If you're on Medicare and you've spent even one night in a hospital, there's a good chance you were billed thousands of dollars more than you should have been, and your doctor never told you why. A Brown University study examining over 29 million Medicare beneficiary records found that the nationwide ratio of seniors being held under a specific billing status, rather than formally admitted, rose by 34% over just 3 years. Most seniors assume that if they're lying in a hospital bed receiving care, Medicare Part A covers it. That assumption is costing people thousands of dollars. The hospital isn't doing anything illegal, but they are using a billing loophole that almost nobody explains to patients until it's too late. In this video, you'll learn exactly what this trick is called, how hospitals use it, how much it's actually costing seniors across America, and most importantly, the exact steps you can take to protect yourself before, during, and after a hospital visit. Everything in this video is sourced directly from the Centers for Medicare and Medicaid Services, or CMS, NE-published research, and federal law. No opinions, no guesswork. Let's start by understanding exactly what this billing trick is all about. When you go to a hospital and stay overnight, the hospital must officially classify you as either an inpatient or an outpatient under observation. To the average patient, these two sound identical. You're in the same bed, same room, same nurses. But on paper, they are completely different billing categories. The key difference is in how Medicare pays the hospital and what you end up owing. Here's the financial difference, and these are hard numbers for 2025. If you're classified as an inpatient under Medicare Part A, you pay one deductible of $1,676, and your room, nursing care, and tests are all covered. That means for a typical hospital stay, an inpatient might pay just the deductible and be done. But if you're under observation as an outpatient under Part B, every single service is billed separately. You pay 20% of every test, procedure, medication, and nursing service. And there is no cap on your total out-of-pocket costs in original Medicare Part B. That lack of a cap is what makes observation status so risky. A single hospital stay under observation can easily lead to out-of-pocket costs that are double or triple what an inpatient stay would have cost you. But here's where it gets even more serious for seniors. Medicare will only cover skilled nursing facility care, like rehab after a hip replacement, if you were admitted as an inpatient for at least 3 consecutive days. Observation days do not count toward that 3-day rule, no matter how many nights you spent in the hospital. This 3-day rule is one of the biggest gotchas in Medicare. Many families only discover it when they're trying to arrange rehab and get hit with a huge surprise bill. Imagine this. A senior spends 4 nights in a hospital under observation status, needs rehab afterward, and discovers Medicare will not pay a single dollar of the nursing facility bill, which can run $200 to $600 per day. That's potentially thousands of dollars out of pocket that they never expected. This is not a small issue. Post-hospital rehab is often essential for recovery, and having to pay full price for it can be financially devastating for retirees on fixed incomes. So why do hospitals do this? Hospitals have a financial incentive to classify patients as observation rather than inpatient, because CMS penalizes hospitals for readmitting inpatients too quickly under the Hospital Readmissions Reduction Program. Observation status is a way hospitals protect themselves from financial penalties while the financial risk shifts entirely to the patient. The Hospital Readmissions Reduction Program was meant to improve care quality, but it created this unintended consequence where hospitals err on the side of observation to protect their bottom line. Now let's look at how big this problem really is, with some real data from major studies. A JAMA Network Open study from 2022 found that observation stays increased from 14.1% to 21.3% of total. Hospitalizations among Medicare patients over the study period. That's a massive and rapid shift. This increase represents hundreds of thousands of additional seniors being placed in this limbo status annually, each one potentially facing higher costs and coverage gaps. Another study published in PMC in 2019 demonstrated that Medicare's observation policy leads to decreased access to post-acute nursing care, increased out-of-pocket, costs especially for low-income patients, and poor patient understanding of the policy. The research shows real consequences like higher costs and barriers to needed care after discharge. The Office of the Inspector General found that 22% of observation stays exceed 2 midnights, meaning patients who should have been admitted as inpatients were kept in observation status far longer than intended. That's nearly 1 in 4 observation stays that went on longer than the policy intended. There's also a second trick you need to know about: Part B excess charges. This is separate from the observation issue, but just as important to understand if you're seeing doctors outside the hospital too. Medicare has an approved amount for every medical service. Doctors who accept Medicare assignment agree to accept that amount as full payment. But doctors who are non-participating, they still accept Medicare but do not accept assignment, can legally charge you up to 15% more than the Medicare-approved amount. This is called a Medicare Part B excess charge, and Medicare will not cover it. Here's a real example with actual numbers. If Medicare's approved amount for a service is $500, a non-participating doctor can charge you $575. Medicare pays 80% of the $500, which is $400. You owe $100 in coinsurance, plus the $75 excess charge. That's $175 total out of your pocket. So instead of paying just your 20% share, you're paying that, plus the doctor's extra markup. It adds up fast if you have multiple services. And then there's the charge master, the hidden price list every hospital maintains. A Johns Hopkins University study published in Health Affairs found that hospitals on average charged 4.3, 2 times the Medicare allowable cost across all services. For-profit hospitals were even higher at 6.3, 1 times Medicare cost. For specific services, the markups were extreme. CT scans at 28.5 times Medicare allowable cost, anesthesiology at 23.5 times, and MRIs at 13.6 times. These charge master prices are most dangerous for patients who are uninsured or fall into billing gaps created by observation status. These are the list prices hospitals use internally, and they're often wildly inflated compared to what Medicare actually pays. When you're in observation status, you're more exposed to these high charges because Part B doesn't have the same protections as Part A. Now here's something hospitals are required to tell you. As of August 2025, federal law, the Notice Act, requires hospitals to notify any Medicare patient who has been receiving observation services for more than 24 hours. The notification is called the MOON, Medicare Outpatient Observation Notice. Hospitals must deliver this notice no later than 36 hours after observation services begin, and the updated MOON, effective April 21, 2026, is required to be used at all hospitals and critical access hospitals for all Medicare beneficiaries, including those in Medicare Advantage plans. This is a critical protection that was strengthened recently. The update in April of this year, 2026, made it mandatory everywhere, including for Medicare Advantage patients who were sometimes left out before. Key point: if a hospital puts you in observation status and does not give you this notice, they are violating federal law. So what can you do about all this? Let's go through your complete action plan before, during, and after a hospital visit. The first thing you should do before heading to the hospital is protect yourself from excess charges and surprise billing situations. Always ask if your doctors accept Medicare assignment. Use Medicare's official Find a Doctor tool at medicare.gov to verify assignment status before scheduling any appointment. And here's good news. In 8 states, excess charges are completely banned by law: Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, and Vermont. Why is this important? Because knowing your doctor's status up front can save you hundreds of dollars on every visit. Next, consider getting a Medigap Plan G. This Medicare supplement plan covers Part B, excess charges in full. Plan F also covers them, but it's only available to those who turned 65 before January 1st, 2020. Medigap Plan G is one of the smartest investments many seniors make because it closes so many of the gaps we've been talking about. And before any scheduled hospital procedure, ask your doctor up front, will I be admitted as an inpatient? You have the right to ask this question. If you're told you are going in for observation, ask why you cannot be admitted as an inpatient and have that conversation documented. Having it in writing can make all the difference if a dispute arises later. During your hospital stay, watch for the MOON notice. If you've been in the hospital for more than 24 hours and have not received a written MOON notice, ask a nurse or hospital administrator for it immediately. This notice must clearly state your observation status and explain what it means for your Medicare coverage, including the skilled nursing facility consequence. Do not wait. The sooner you have this information, the sooner you can take action to protect your coverage. Also, ask to speak with the hospital's patient advocate or case manager. Request a formal review of your admission status. Hospitals have case managers whose job includes reviewing whether patients should be reclassified from observation to inpatient under CMS guidelines. These professionals can often get your status changed if the clinical picture supports it. Know the 2 midnight rule. CMS's official policy states that if a doctor expects a patient to require hospital care for at least 2 midnights, that patient should generally be admitted as an inpatient, not kept in observation. If your stay crosses 2 midnights and you're still under observation, raise this directly with your doctor and the case manager. This rule exists to protect patients like you from exactly the kind of limbo we've been discussing. After you receive a bill, request an itemized bill immediately. You have the legal right to request a full line-by-line itemized bill from any hospital. Do not accept a summary bill. Check every charge against your Medicare Summary Notice, or MEN, which Medicare mails every 3 months or is available at mymedicare.gov. Go through it, line by line. You'd be surprised how often errors appear. If you need to dispute something, file a Medicare appeal. For Original Medicare, circle the disputed item on your MEN, attach a written explanation, and mail it to the Medicare administrative contractor within 120 days of the date on your men. The MAC must respond within 60 days. The process is free and designed to give you a fair hearing. And if you received a bill that is $400 or more above the good faith estimate you were given before care, you can file a formal dispute through CMS's patient. Provider Dispute Resolution Process. An independent third party reviews the bill and determines fair payment. This is a powerful new tool that levels the playing field between patients and providers. Now let's bust some common myths that catch seniors off guard. These misconceptions lead to thousands of unexpected bills every year. Myth number 1. If I'm in a hospital bed, I must be an inpatient. The truth? Absolutely not. You can spend 4, 5, even 6 nights in a hospital room receiving active care and still be classified as an outpatient under observation status. Your physical location inside the hospital has no legal connection to your billing classification. That's why asking the right questions matters so much. Myth number 2. My doctor chooses my admission status. The truth is, in most cases, hospitals, not your personal physician, make the final determination on whether you are classified as inpatient or observation. This is often driven by hospital administration and billing departments using CMS guidelines as cover. Your doctor may recommend admission, but the hospital's utilization review team often has the final say. Myth number 3. Medicare will cover my nursing home care after my hospital stay. The truth? Only if you were officially admitted as an inpatient for at least 3 consecutive days. Days spent in observation status, even 4 or 5 nights in the hospital, do not count. Seniors have received nursing facility bills of $10,000 or more because they did not know this rule. Do not assume. Always verify your status before discharge planning begins. So what does all this mean for you? You now know something that most Medicare beneficiaries, and honestly many doctors, don't fully understand. These aren't rare edge cases. These billing situations happen to millions of seniors across the U.S. every single year, and the people who get hurt most are those who trusted the system to explain it to them. This knowledge gives you real power. You don't have to be a victim of the system. Here are your 3 key takeaways. Number 1, always ask your doctor if you will be formally admitted as an inpatient, not just observed, especially if a nursing home stay might follow. Number 2, watch for your moon notice. If you don't get one within 24 to 36 hours of a hospital stay, ask for it. It's your legal right. Number 3, you can appeal Medicare billing decisions. You have 120 days, and the process is free. Write these down. Put them on your fridge. Share them with your family. If this video helped you, share it with a parent, a spouse, or a friend over 60 who deserves to know this. A simple share could save them thousands of dollars. We cover exactly this kind of documented, research-backed information for seniors every week on this channel. Hit subscribe so you don't miss what's coming next. And if you found this valuable, consider leaving a comment below with your own experiences or questions. We read every one. Next, we're going to cover the Medicare drug pricing gap that still catches millions of seniors off guard, and what the new policy changes actually mean for your wallet. Until then, stay informed and stay protected.